Hey everyone, so now let's get started and we'll be revising or studying the glomerular diseases and thus the pathogenesis of glomerular injury. So firstly the in situ immune complex disease, okay? In situ immune complex disease, which is first the anti-GM antibody induced nephritis. So anti-GBM antibody induced nephritis, the antibodies are directed against intrinsic fixed antigens that are normal components of the glomerular basement membrane, okay, proper resulting in a diffuse linear pattern. So यहाँ पे क्या होता है, diffuse linear pattern form होता है of staining for the antibodies by the immunofluorescence techniques. This is model of anti-GBM disease, which is good Pasteur syndrome. ठीक है, anti-GBM means glomerular basement membrane, which is the good Pasteur syndrome, which is caused by antibodies against non-collagenous domain of the alpha-3 chain of type 4 collagen. So antibodies formed होती है against non-collagenous domain. So antibodies are formed against the non-collagenous domain of the alpha-3 chain of the collagen type 4. So this is the good Pasteur syndrome. ठीक है, कि antibodies formed होती है against non-collagenous domain of the alpha-3 chain of collagen type 4. Second one is Hayman's nephritis. So Hayman's nephritis में क्या होता है? The antibodies are directed against intrinsic fixed antigens called Hayman antigen or Migalin. So Hayman antigen is also called Migalin. The antibodies are directed against intrinsic fixed antigen. Means जो antibodies होती हैं कहाँ किसके अगेंस्ट डायरेक्टेड होती हैं? अगेंस्ट एक फिक्स्ड एंटीजन होता है इंट्रिंसिक, विच इज हेमन्स एंटीजन और मिगैलिन, located on visceral epithelial cells. तो कहाँ पे होता है? visceral epithelial cells पे, resulting in complement activation and formation of subepithelial deposits and a granular pattern of staining for the antibodies by immunofluorescence techniques. Now the third one is antibodies against planted antigens. Okay, antibody against planted antigens. So antibodies against planted antigens, antibodies can react with antigens that are not normally present in the glomerulus but planted there. So these are planted, जो normally present नहीं होती है but वो plant की जाती है वहाँ पे. These antigens include cationic molecules. Cationic molecules होते हैं like DNA, nucleoproteins, bacterial, viral and parasitic products and drugs. A granular pattern of staining is observed by immunofluorescence techniques. तो कौन सा pattern होता है? Granular pattern of staining is observed by immunofluorescence techniques. So antibody against planted antigens में granular pattern of staining होती है by immunofluorescence techniques. And here diffuse linear pattern of staining होती है कहाँ पे? anti-GBM antibody induced nephritis में. okay, and तो और antibodies against planted antigens में कौन सा होता है? It is the granular pattern of staining. Now circulating immune complex disease. So circulating immune complex disease, the glomerular injury is caused by entrapment of circulating antigen antibody complex. So क्या होता है कि entrap हो जाते हैं जो हमारा antigen antibody complex होता है within the glomeruli. So this results in complement activation, leukocytic infiltration and proliferation of glomerular and mesenchymal cells. The endogenous antigens includes DNA, tumor antigens, whereas the exogenous antigens includes infectious products. Electron microscopy reveal the presence of immune complexes as electron-dense deposits lying in the mesenterium between endothelial cells and the glomerular basement membrane, subendothelial deposits, or between the glomerular basement membrane and the podocytes. Okay, कि इलेक्ट्रॉन माइक्रोस्कोपी क्या रिवील करती है? प्रेजेंस ऑफ इम्यून कॉम्प्लेक्सेस. देखिए इलेक्ट्रॉन माइक्रोस्कोपी क्या कर रही है? इम्यून कॉम्प्लेक्सेस as electron dense deposits lying in the mesenterium between the endothelial cells and the कहाँ पे? endothelial cells and the glomerular basement membrane के पास, और between the glomerular basement membrane and the podocytes. ठीक है, दो जगह पे मिलते हैं. कहाँ पे? endothelial cells और glomerular basement membrane के बीच में, और glomerular basement membrane और podocytes के बीच में होता है. By immunofluorescence microscopy, the immune complex can be seen as granular deposits on the basement membrane in the mesenterium or both. Now, nephritic syndrome and nephrotic syndrome. So nephritic syndrome is proteinuria, hematuria, hypertension and azotemia, oliguria. Proteinuria is 1 to 2 gram per d and hematuria is hypertension and azotemia and oliguria. Now in nephrotic syndrome we are having severe proteinuria more than 3.5 gram per d, and hypoalbuminemia, and in this there's less than 3 gram per deciliter, and edema, and hyperlipidemia and hyperlipiduria is in the nephrotic syndrome. Okay. Now, the thrombotic and thromboembolic complications are common in nephrotic syndrome. So, जो thrombotic और thromboembolic complications कहाँ पे common होती है? Nephrotic syndrome में होती है due to loss of anticoagulant factors like antithrombin 3, protein C and S, combined with increased platelet activation. Now, renal vein thrombosis is the most often a consequence of this hypercoagulative state, especially in case of nephrotic syndrome associated with membranous nephropathy in adults. There is also increased synthesis of fibrinogen in the liver. Now, the anionic antigens form the subendothelial deposits and cationic form the subepithelial deposits. Neutral antigens form mesangial deposits, and dehydration is the common cause of primary renal vein thrombosis in children.